So when they come into the office, first thing we're going to do is do a thorough case history with them. Ask them what's bringing them in, what concerns they may have about their hearing, what kind of symptoms they may be experiencing, that kind of thing. Then we bring them into our booth and do some testing. Look in their ears, make sure it's clear from wax and it's not something as simple as that. Then we do some testing where they hear beeps and they press a little button when they hear a beep, and we're looking for the softest sound so they can hear. And we test very low pitched tones, so like a bass tone, up to a very high pitched tone, like a high frequency sound, and look at the softest sound they can hear across those different pitches. This is our piece of equipment that tests the middle part of the ear, so we can put a probe tip in the ear and we get movement of the eardrum, and if we get normal movement, we can say that the middle ear is normal. We don't have fluid behind the eardrum, it's not an ear infection, or it's not wax plugging the ear, something like that. We can also look at, see if there is fluid behind, and it'll tell us that kind of result on the test here. And then this other machine we have here is our audiometer, so that's what's going to present the tones and have people listen to those tones. And we also do some speech testing where we look for the softest sounds that they can hear, or the softest speech that they can hear, and look at how well they're understanding words in quiet situations and also in background noise. As soon as we're done with the testing, we have the test results. So we go through a bunch of tests within the booth with listening to tones, and we put different pieces of equipment on other than earphones as well. And then when we're done with all of that, we go over all the test results. You'll have the results right then and there. We usually schedule about an hour for that. By the time we get to know you and find out what your problems are, go through the testing and give a good chance to explain the test results. And we want you to have a thorough understanding of what your results are and what they mean. A lot of our tests are double checks with each other, so we have ways of verifying what we're seeing. So even if you're very nervous for the test and you want to make sure you hear that that beep before you press the button, we have ways of kind of seeing that within our test results. And we will either retest within the session, but that's part of our training, is to make sure we have an accurate test and help guide you through to make sure that those nerves don't get in the way of the testing. From my perspective, it has nothing to do with getting old. It has to do with a lot of the noise that we're exposed to in our society, just what our ears are, our genetics. There's lots of other causes of hearing loss that have nothing to do with our age, but a lot of people associate it with an age-related thing. So they do get a little nervous about it. They're more reluctant to want to come in because they don't want to get that news. But sometimes I give good news. It might be normal, and I have had that happen. It's not as bad as they think, or it's not ready for hearing aids yet. It's a little bit of loss, but we're just going to monitor it. So sometimes there's good news. The quality of life after they get amplification for treating hearing loss that truly needs to be treated really makes a huge difference for them. They're saying things like, I can communicate with my family. I'm not as frustrated. I'm not as tired. I'm not as exhausted at the different events that I have to go to, because I'm not having to think through all these communications. I can just naturally hear things so much better. So I hear it all the time about just how positive it really can impact people's lives.